Hi, my name is Kinsey and I will be demonstrating how to insert a Foley catheter. So I've already checked Mrs. Smith's doctor's orders and it looks like they have ordered her a Foley catheter. So I'm going to enter the room. Hello Mrs. Smith, my name is Kinsey. I'll be your WT nursing student today and it looks like your doctor has ordered you a Foley catheter. So before we get started, I want to know if you have any allergies to shellfish, betadine, or iodine. Okay, and then do you mind verifying your name and date of birth? Okay, and then lastly, are you okay with this procedure being done? Okay, perfect. So we would go ahead, clean our hands, apply some gloves, and we would perform perineal care. So wash her up and everything. And then after that, I'm gonna make sure this is good and out of my way. Or we'll probably like apply a pad or something because we might get some dribble when we're inserting the catheter. So we have our Foley catheter kit and a pair of sterile gloves and then our mineral oil. On a normal person you would use the lube that's in here, but because she's for practice on, we have to use this oil instead. So I can take out this portion and it's best to just kind of like toss to the ground. I can, well, I might move, oh goodness, I'm gonna move this over here, close to my patient. And I would do this and this, making sure I'm not breaking sterile field. And then, oh goodness. It likes to fold back on you. Okay, and before I start taking anything out, I need to apply my sterile gloves. I'm gonna take them out of here. I'm gonna go ahead and put this in the bed real quick, just beside her leg for later. And we're gonna kind of crab hand it. And go like this. Oh, that's not supposed to happen, but I feel like it rips easily, so that's okay. And this is upside down. Is it? Okay, I'm just going crazy. So you have to kind of like do this little hand motion, pull it in, making sure you're not touching outside. And that's okay for now because we can fix it later with the other sterile gloves. I'm gonna pull back as much as we can. This is annoying to me. Okay, oh, sweet. And then for the other one, you're gonna put your hands in here. And same thing, kind of wiggle your hand in there. Pull back as much as you can. Okay. I feel like I'm gonna swell up again, like I did earlier. That's okay, sterile can touch sterile. We wanna make sure that we don't put our hands anywhere outside this box. So even if you like turn around, you're not supposed to do that. You can't take your eyes off this box or off your hands. So we don't need these things. We're just gonna take it all and plop it on the ground because we do not need it. We only need one set of these swabs, so put that on the ground as well. I can move this towards my patient. And I'm gonna save this for later to label. Keep this and keep this. The rest will go away. Okay. So my first thing I'm gonna prep is her Foley. I'm gonna put that there. Make sure there's no little bubbles. And that is all you have to do. After that, we would take our little swab sticks, open them up, and put them right here. So I'm gonna take one out, clean, drop. Take another one out, clean, drop. And the last one, clean the inside, and oops, it's stuck in there. Okay, drop. And I can throw this out now. Okay, and then we are gonna take our the end of the Foley tubing and kind of put this aside. And I get some of that mineral oil Make sure this is nice and lubed up. Okay. And once I touch the patient, ruin sterile field. I'm gonna open her lips up and, okay, give me a cough. Okay. And 1, 2, 3. Well, maybe. Okay, 1, 2, 3. Perfect. She's kind of fighting me. Oh man, I have to kind of, there we go. We want to go pretty far in, make sure that we're in the bladder. There we go, that should be good. And then we're gonna put in about 5C of this saline solution because we have a 12 French Foley. Now, on a real person, you won't get like fight back, but because this is a dummy, it'll immediately start to go back into the syringe. But on a normal person, it would inflate the balloon. That way they can't, well, we hope that they don't yank it out. They might, we hope not, but it'll make it harder for it to come out. Okay, now once that's done, I can put this off to the side. You no longer need it. I would secure it to the right leg. And then I would, sorry ma'am, I kind of made it hard for you again. I would secure it to the bed, not the guardrail, but somewhere inside the bed. So like, right here. That's not great. Newer beds have places to put the Foley, but you would make sure that it's lower than the patient, no kinks in the tubing, and on the right side. Okay, and so for documentation purposes, after cleaning her back up, providing privacy again, making sure she's okay, and my 4 Ps are all done, patient safety checked, we would document date, time, 12 French, that we put in 5 cc of the saline solution. We would monitor, or not, we would say right side secured by tape and hung on the right side below or lower than the bladder. We would also document how much urine came out. We'll say it's, well, depending on the color of the urine, describe the color, so maybe yellow, clarity, either clear, cloudy, and then if there's an odor, so it could be foul smelling or no odor smelled. And then we would do my name and my initials, and that should be good for documentation. Yep. Okay, and now I'll be demonstrating how to remove the Foley catheter. So it looks like we got our doctor's order, and I checked several times because we don't want to have to redo this over again. But yes, Mrs. Smith is going to have her Foley catheter taken out today. I'm going to enter the room. Hello, Mrs. Smith. My name is McKensi, and it looks like your doctor ordered for us to take your Foley catheter out. So we'll go ahead and get started. All you'll need is like an empty syringe and then a pair of gloves. Okay, so what we'll do first is provide perineal care, clean her up and everything. And while you do that, you'll be wearing gloves. You also want to make sure that the catheter is emptied and that you have a biohazard bag to put it in. Okay, and so what I'm gonna have her do is we're gonna grab this. We're gonna try and get out all the fluid to deflate that balloon. You should be getting out as much fluid as you took in. So if you had 5 cc, 5 cc should be coming out. Okay. Okay, there we go. And I'm gonna have her bear down. And 1, 2, 3, and I will pull it out. Oh wait, I would have a little paper towel right here to kind of clean her up with, making sure that, oh my goodness, in case there's dribble, we'll have something to catch it. But right now we have her on like a little pad. Okay, ready, 1, 2, 3. There we go. Okay, and I will make sure this goes into a biohazard bag. I will clean her up again because there will be urine coming out. We'll cover her back up, dispose of everything properly, and we'll get her all comfy. Make sure our 4 P's are checked off and patient safety is also checked off as well. And when we would document, we would make sure time, date. The French made sure that all the liquid that we put into the balloon came out of the balloon. We would know if there was any blood, any discomfort. That patient tolerated well, and whatever was in the bag, we also want to document how much we took out. So like, let's say we came to the room, there were 600 milliliters or something like that, we would also document that too. But other than that, I think that is all we needed.